Hello friends, welcome to Creative Medicine. In this lecture, we will learn about a patient presents to the emergency department with self-harm and indicates a suicidal intent. Which of the following does not warrant an immediate specialist assessment? Okay, here the patient has self-harm. Number one important here is suicidal intent. And the patient has self-harm and indicates suicidal intent. Immediate specialist assessment is, so he had suicidal intent. Now, if the patient has formal thought disorder, always think of schizophrenia. Okay, in this case, you will have to refer him to a psychiatrist. If the patient has chronic severe physical illness, or if the patient has social isolation also, it should be referred to a psychiatrist. But if he is an alcohol intoxication, then it is in a inebriant state, or when he is in not completely conscious or semi-conscious state, he has tried to commit suicide. So here, if it is in acute alcohol intoxication, you can defer or wait till the patient recovers. If the patient is okay, that if the patient is not going to self-harm again. The suicidal intent in a person with formal thought disorder or chronic severe illness and social isolation, in these three cases, you should take it very seriously and you should refer him to a specialist. But if the patient has suicidal intent in inebriant state, then it must be ensured that he does not harm himself. So specialist assessment can be deferred till he is a sober. Thank you, and thank you for watching.